Hi, my name is Nader Yermian. I am a general dentist with an emphasis in cosmetics and minimally invasive dentistry. My niche is biomimetics, which really means that you want to make a restoration similar to the biology, function, and aesthetics of a natural tooth. A vampire smile procedure pretty much means that you want to make the canines, which are the pointy ones over here, the fangs, a little bit longer than they traditionally should be. So in this particular case, I am seeing a patient who is interested in veneers. She has a missing front tooth, and back when she had orthodontics, the dentist shifted her smile and closed the gap where when this tooth was missing, the canine was shifted over to cover the space. So in her case, we're doing porcelain veneers and we're able to meet her aesthetic desires and have longer, pointier canines for her. The entire procedure could range, and it's done in different ways. It could take a week, it could take 2 months. Sort of depends on where we are in the beginning stages. So for first and foremost, we want to make sure that her color is okay. So we start the whitening process, because anything that you put on your mouth and on your teeth will never change color. Your natural teeth would change color, but the porcelain veneers or any kind of restorations would never change color. So we want to make sure her teeth are at a happy color. So we start the whitening process, and in the meantime, what we do is we have these models, we send them to a laboratory, and we get a wax prototype. And this prototype is what we use as a template for the patient to take out her smile for a test drive. The best way for me to think about it or talk about it is pretend that you're taking out a car for a test drive. You're actually able to test it, and you can do that for 30 minutes or you can do that for 2 weeks. It really depends on how long you want to test it for. So we could take it out for a test drive, and then after she commits to it, we could go ahead and start the process. Usually after that, it's 2 appointments, the preparation appointment where you prepare the teeth, you take an impression, and then you also give them a temporary based off the prototype of the new smile design. And then the last appointment will be cementing the case. So we use a bonding protocol and we cement each veneer individually. This specific procedure took a little time because of whitening. So the best way of whitening your teeth is with custom trays that are fitted for your mouth and gel, bleaching gel. The laser whitening, the instant whitening really doesn't work, especially if you want to do porcelain veneers. The reason why it doesn't work is what the laser really does. It just really opens up your opens up your dental tubules, or the little pores in your teeth, and as the tubules expand, the water just comes out, and it makes your teeth look dehydrated, which will give a whiter appearance, but within like 5 or 7 days, the color relapses, and we don't want that. We want something that really lasts a long time. So what we do is the whitening trays with bleach, and she does that until she's happy. So it took about 2 to 3 weeks. And then when she was at the color that she's at, then we're able to try on the prototypes, to try the smile. It's called a mock-up, and you can wear that for about a week or 2 or however long you want, and then you could go ahead and commit to the procedure. Once you commit to the procedure, the typical turnaround for this is about 2 weeks, but you sometimes you can rush it and get it done sooner. Sometimes if you want to wait and wear the tempers a little longer, it might take a little longer. But typically this could range from anywhere from a week to 2 months even, depending on how you want to take it. So it's really trying to meet her aesthetic desire. And a lot of times it's sort of hard for us to guess that. You have people who have this picture in their mind and they have this image in their mind, and we as a dentist and the ceramist try to replicate that. So it's a little bit of a challenge, but what we do is we do the prototype. We do the wax up and we're able to apply it in the mouth that's called a mock-up, and she's able to wear it, and then she can make those changes to that. And in fact, with the vampire smile that we're doing, we actually decided to make the canines of the vampire teeth a little bit shorter, because as she's wearing the mock-up, she realized it's a little harder for her to chew on. So we're gonna shorten it a little bit based on the mock-up that we have. And that gives us an idea of what her smile could potentially look like, or her prototype. So, and that's overall the process. Again, we're meeting her aesthetic desire. And from this procedure to a lot of other procedures that we do, you have patients or you have people who are really self-conscious about their smile. She not only has short canines or shorter teeth, but her front two teeth are a little darker, which we're going to correct because of trauma that she had. Her teeth are misshaped, and you've had some patients who've been wanting stuff like this ever since middle school. So it's a very important thing to get right, because it is, and for lack of a better word, it's life-changing for most patients.